Everyone, thank you so much for being here this morning. We do appreciate you taking some time out of your busy schedules to be with us. As you know, Orange County has been under a facial covering order for nearly a year. Mayor Demings and staff have collaborated with scientists and researchers to make decisions that are based upon science. With that, the mayor has a major announcement on an amendment to the facial covering order. Mayor Demings is joined by Dr. Raul Pina from the Florida Department of Health here in Orange County. We will take a few questions after we are done with the press conference. We will begin with Mayor Demings. Mayor?
Thank you, Dr. Williamson, and thank you to all of you for joining us here today. As you well know, the Centers for Disease Control issued new guidance yesterday on outdoor mask use for fully vaccinated Americans. If you are fully vaccinated and want to attend a small outdoor gathering with people who are vaccinated and unvaccinated or dine outdoors, the science shows that you can do so safely without a mask. However, the CDC says to avoid large gatherings. As I have said many times before here in Orange County, we do follow the science. And after receiving research from multiple sources, including the Florida Department of Health, the University of Central Florida, and local hospitals, I have amended my facial covering executive order. My goal is to give guidance to the community as we continue to navigate through the pandemic. There will be 3 phases associated with this experience. Phase 1 will be effective immediately. Phase 1 includes reducing physical distance from 6 feet to 3 feet in all settings. Fully vaccinated individuals should follow CDC guidelines for wearing facial coverings. This is what the CDC guidelines say. Fully vaccinated people can do the following: visit with other fully vaccinated people indoors without wearing masks or physical distancing. They can visit with unvaccinated people, including children, from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing. They can participate in outdoor activities and recreation without a mask, except in certain crowded settings and venues. They can resume domestic travel and refrain from testing before or after travel or self-quarantine after travel. They can refrain from testing before leaving the United States for international travel, but of course, unless required by the destination, and refrain from self-quarantine after arriving back in the United States. They can refrain from testing following a known exposure if asymptomatic, with some exceptions for specific settings. They can refrain from quarantine following a known exposure if asymptomatic. And lastly, they can refrain from routine screening, testing if asymptomatic and feasible. Again, while we are currently in phase 1, for now, fully vaccinated people should continue to do the following: take precautions in indoor public settings like wearing a well-fitted mask or facial covering. Wear well-fitted masks when visiting indoors with unvaccinated people who are at increased risk for severe COVID-19 disease, or who have an unvaccinated household member who is at increased risk for severe COVID-19 disease. But they must wear well-fitted masks when visiting indoors with unvaccinated people from multiple households. Avoid indoor large-size in-person gatherings. Get tested if experiencing COVID-19 symptoms. Follow guidance issued by individual employers, and follow CDC Health Department travel requirements and recommendations. Now, for our community, we anticipate moving to phase 2 effective when 50% of the population 16 and older has received their first dose of the vaccine. Facial coverings or mask mandates for outdoors will be lifted for all individuals. Physical distancing of at least 3 feet between groups is encouraged. Masks are still required for all indoor activity except when eating or drinking. We anticipate moving to phase 3, effective when 70% of the population in Orange County, 16 and older, has received their first dose of the vaccine, and/or Orange County's 14-day rolling positivity rate is 5% or below. In that instance, under phase 3, all mandates would be lifted. To put all of this into perspective, the 14-day rolling positivity rate yesterday was 8%. We have to work hard to get down to 5%. Also, the number of Orange County residents 16 and older who have had at least one dose of the vaccine is 43.4%. Remember, the goal is to get up to at least 70%. I believe these are sensible and achievable goals. We are seeking to ensure that we are making progress. In other words, there's light at the end of the tunnel. I'm making this announcement with caution. I do not want us to get complacent. 1,239 residents have died in our community so far from the virus, and 135,000 plus have contracted the virus. Further guidance: if it is unknown whether a person is fully vaccinated or not, you should assume that they are not. If you don't know the person around you, assume that they have not been vaccinated and protect yourself. And so, again, that is the announcement that we're making today, consistent with the CDC guidelines and also taking into consideration our unique experience here within Orange County. At this time, I'm going to open it up to any questions that you may have. I am, of course, joined by my partner in this public health crisis, Dr. Raul Pino of the Florida Department of Health in Orange County, for any questions.
Why did you decide to go to 70% to completely drop the mask?
Again, we have received an abundance of research and information and coordination and collaboration with our local hospitals, epidemiologists, infectious disease physicians, Dr. Pino and the Department of Health. The goal there is to get closer to the percentage of herd immunity to protect all of us. And again, what we're talking about is 70% of the population 16 and older, not the entire population. Remember that at this point, if you are under the age of 16, there is not presently an opportunity to get vaccinated. In other words, we cannot vaccinate children within that age group. So we're focusing on those who can get vaccinated.
What would happen? What would happen with people that won't comply with the executive order?
Remember that this is all guidance. We will continue as it relates to the enforcement of the executive order. We have looked at this from a proactive perspective. We have continued to send our compliance teams out to gain compliance with our businesses here in Orange County. And we've received tremendous success. 99% or so of our businesses are complying. And so I have no reason to assume that we will not continue to receive that compliance. Again, we're making modest, appropriate adjustments in the direction that we have given in this county by, again, reducing the social distancing requirements. And we're giving you an indication of what you can anticipate going forward into the future. So if you want to know when will we get to the point where we will not be required to wear facial coverings, I've given you the indication of what we have to achieve. We are still in the midst of a pandemic. The virus is still spreading in our community. So we collectively, all of the residents of Orange County, still have this responsibility to help protect ourselves and our entire community. Unlike many other metropolitan areas around the world, certainly around the United States, there's not many of them pre-pandemic had 75 million people coming to visit. So because we are still somewhat open, a tourist destination, these are the things, sensible things that we have to do to protect ourselves as we continue to move forward. Dr. Pino could give you some estimates on when he thinks we will reach that pinnacle of having 50% or more of those 16 and older to get to phase 2, and then phase 3, 70% or better. He can give you an indication of when we would reach that. He has said to me that he believes that in terms of the 50% threshold, that could be within the next 3 weeks or so.
Mayor, it's Nadine with News 6. I have a question for you, and then would love to hear that timeline from Dr. Pino, and one question for Dr. Pino. Yesterday we had spoken about the theme parks, and you're thinking they're going to probably change things. A lot of things are outdoor, our theme parks and attractions. They have told us they're going to rely on county leaders. Have there been any conversations and what changes we could be seeing in our tourism district? And for Dr. Pino, wondering if the rolling day average of the positivity rate gets below 5% before we reach 50%, would we go to phase 3?
Okay, so in terms of have we had any communication with our theme parks? Yes, we've had communication with them. They will make some adjustments. I believe the adjustments that they will make will be based upon keeping their guests safe, and this allows them as they manage the lines and other things for those outdoor types of settings and even indoor, they're able to increase capacity as a result of that. In terms of the timeline, certainly I will invite Dr. Pino up. He can address when he thinks we may reach those various thresholds there. Dr. Pino.
Good morning. Oh, still morning, yes. So with regard to the question with the 50% and arriving, it shouldn't happen. It shouldn't happen that we are not at 50% or above and the infection rate dropping to 5. Actually, the infection rate could increase a little bit more because of some of the dynamics. And everyone should remember what the mayor just said. Orlando and Orange County is quite different in the sense that we are a place where everyone comes from everywhere in the world. Even if we are all vaccinated, it's going to be a high percentage of individuals that will come and visit who are not vaccinated. Not everywhere in the world have the same program vaccination that we have. With regard to the first question, if the parks adhere to the CDC guidelines, they should be masked. The CDC guideline specifically said that congregated outdoor settings should use masks for vaccinated and unvaccinated people, and they surely fall into that category. So it all depends. All things considered, and if we keep the same level of immunizations that we have, we should be there before 3 weeks at the 50%. Other things could happen. We could vaccinate more people and they get there quicker, or perhaps if the federal government release the data from the VA and the Department of Defense, we probably could see a quick increase of the number of vaccinated people that are not currently in our databases. Me la pusiste dura porque no la tengo delante. Pero bueno, voy a tratar. Si cometo algún error, me perdonan, no la tengo delante. Van a haber 3 fases. La primera fase comienza inmediatamente y tiene en consideración reducir la distancia de 6 pies a 3 pies y de mantener las orientaciones que dio el Centro de Prevención de Enfermedades ayer para el uso de máscara. Básicamente, las personas que están inmunizadas pueden no usar máscaras en los espacios abiertos, excepto por esos espacios donde hay un grupo grande de personas. Y también cuando visitan la familia, cuando están en los grupos familiares. La segunda fase entraremos en ella cuando lleguemos al 50% de las personas mayores de 16 años vacunadas con al menos la primera dosis. Y esa también mantiene la máscara para indoor settings. Y en la tercera fase, cuando lleguemos al 70% de las personas vacunadas con la primera dosis mayores de 16 años, o si tenemos un 5% o menos de positividad en los análisis, podemos cualquiera de las dos, a lo que lleguemos primero, entra la tercera fase que elimina todas las restricciones. I just translate the three phases into Spanish.
Either Mayor Demings or Dr. Pino, whoever wants to answer this, based on these new three phases that you've laid out, what do you want small businesses and business owners in Orange County to know about moving forward, about how they operate businesses or how they do their business and how they interact with customers and welcome people in and have them operate in their space?
Well, as a result of the guidance that we are providing, they will be able to reduce the social distancing indoors and outdoors. And in some cases, if they have the outdoor style of cafes where individuals are seated outside, it gives them some guidance to what they can do. And in terms of, if you look at the executive order, there's some guidance also for employers to their employees. With all of this, we're still requiring employees in these indoor settings to be wearing facial coverings. Okay. If there are any questions, other questions for Spanish-speaking media, we do have the ability to do translation for me. We have Ms. Yesenia Negron, who is here, who will assist with that if there are questions for the Spanish-speaking media for me in Spanish. Dr. Pino is fluent, so he can translate for himself. All right.
This is Melissa Thomas of Florida National News. This question is for Dr. Pino.
Dr. Pino.
Based on what Mayor Demings was saying, he was saying this particular decision with the masks is based on the science. So I wanted to find out why base it on 17-year-olds and older who have only gotten the first vaccine, given the importance of having both vaccines to be fully secure from the virus.
So, y yo puedo hablar solamente de la parte que me... Okay. Switching. I can only speak to the part that, correspond to our expertise. In this type of situation, you have to establish a clear cut. And it is a matter of choosing where to land. And the mayor have chosen to land in science and proceed with caution. Again, because where we are, what we do, and what we have here, and to have some control over the process and be able to accelerate the changes of the phases or even slow down if the situation change in a way that we have not been able to predict before. So the 50% was, okay, when we are more than half. Why one dose? Because we think that we need to accelerate administering one dose to at least achieve some level of immunity. And one dose can give you up to, more than 60, 70% of effectiveness just in the first dose. That gets elevated to a 90%. But we also have experienced that about 10 to 15% of the people that have been vaccinated in our county are missing their second dose. So with that, we try also to encourage people to get vaccinated at least with the first dose so that we can move this forward and return to some level of normalcy. But to your point, it is arbitrary? No, because it's based on some level of science. But the 70%, for example, was in the fact that in many instances, science are saying it's between 70 and 80%, depending on where you are, where the pandemic was, what kind of activities in your county. And so it's going to be very difficult to develop one for each place and each situation. So 70% seems to be the lowest number where science agreed that we have achieved some level of herd immunity.
Hi, good evening, Mayor Demings. My name's Tabitha. I have a question. I know you talked about the children. I don't want to go back to that. They're not allowed out of the classrooms a lot. Since this 6 to 3 has already been, do you think the schools will lift and allow them to get outside more? And is there a date or timeline on when they can be vaccinated to be safe?
As it relates to the school district, the Orange County Public Schools and the school board will have to make decisions based upon the guidance that they are receiving from the Commission of Education, from the Centers for Disease Control, and from other experts. Of course, they have made a decision, I believe, internally that for children, they were able to reduce the capacity from 6 feet for social distancing to 3 feet already. But that was specifically based on research that had been done in classroom settings. And so this remains consistent for the general population at large to be able to accomplish increase in capacity indoors and giving guidance for outdoors. And so whether or not the school district will increase the opportunity for children to engage in more outside types of activities, that's a decision that they will have to make. Is the question, what concerns do I have about the airport? The airport remains under some federal guidance and guidelines in terms of travel here within the U.S. Of course, there's still federal directives that require the wearing of facial coverings when you're flying, but also when you are present within the airport, when you're not eating or drinking, you're required to wear facial coverings at all times in the airport. So they still, because it is a federal mandate, they are still under the federal mandate, but they too should be following the CDC guidelines.
One, as it relates to unvaccinated people, it mentions obviously that fully vaccinated individuals should follow the updated CDC guidance. Is everything the same from your original executive order as it relates to unvaccinated people when it comes to wearing masks?
If you are unvaccinated, you still should be wearing facial coverings if you're within that less than the 6 feet distancing indoors or outdoors. You still are required to protect yourself. If you're within your households and you're there with your immediate family, if there are, as we said, if there are high-risk individuals present, then to protect those family members who may be high risk within your households, you should be wearing facial coverings. So there will be the document for the updated executive order should be provided to all of you if you do not have it at this point. There are some unique nuances associated with it.
Bob Hazen from WESH 2. I'm not sure if I heard the answer to this question earlier, but is it conceivable that we could move to phase 3 with skipping phase 2 based on that percent positivity 14-day rolling average? And if that's the case, I mean, how long would that have to stay at under 5%? I mean, if it went down to 5% and then went up to 8% the next time, would it go back to phase 2?
So again, I think a lot of this is contingent upon our actual experience here within Orange County. If for some reason we have accelerated vaccinations going on within our county, we may get to that phase 3 quicker than perhaps we anticipate. It could work in the converse. If we have a slow rate of vaccination within our county, it will be a longer period of time. So we are tied to the performance. Remember, this is a partnership with our community. In order for us to get to the point where we no longer have to wear facial coverings, it takes all of us working together. It takes those who have not been vaccinated to cooperate with the mandates. It takes those who can get vaccinated to get vaccinated. And then in other words, we are controlling our own destiny to some extent of reaching that community immunity that we are so drastically looking forward to. These are our best estimates that sometime within the next 3 weeks or so we could reach the 50% threshold. When we reach the 70%, it's truly unknown. We cannot say with certainty because we don't have a crystal ball to say when we'll get to that point. As it relates to the 14-day rolling positivity rate, what we're saying there is it has to be a sustained 14-day period of time where it is below, at the 5% or below, in order to meet the second portion of that provision under the phase 3 requirement.
Mayor.
So in other words, we would have controlled the virus within our community, and the data will tell us whether or not we have done that.
But it would be as soon as it hits 5% that it gets to phase 2?
No, it's a sustained rolling 14-day period of time that we're looking at for
Mayor.
that 2-week period of time. And I hear someone.
It is. I'm sorry, Mayor, for keep interrupting. Every time I think you're finished with the sentence, you're not. But Michelle Meredith with Channel 2, changing the subject. Sheriff Mina's controversial social media post. Is it a lesson in law enforcement and how things can be interpreted when you post on social media?
The spoken word, the written word, does matter to people. And whenever those of us in leadership positions communicate, we have to anticipate the various ways that what we say can be interpreted and adjust for that. So I'm not sure how Sheriff Mina's social media post is being interpreted by the community. Unfortunately, I have not been focused on that today. And if the inference here is that it's being interpreted negatively, then it would be incumbent upon Sheriff Mina to make any adjustments in what he said to clarify his communication. I wouldn't offer any thoughts on whether he's right or wrong I have not spoken to Sheriff Mina about it. So I think it would be a bit unfair to ask me what I think about it. I haven't spoken to him about it. I don't know the full context of which he was making the social media posts. I think you always have to be careful about your communication. That's what I was suggesting before, is that whenever we communicate with our public, we have to be careful to make certain that we are clear in that communication, which is really why we do these public briefings. We have had, I don't know, probably around 130 press briefings since the point today is about the COVID-19 virus and our response and recovery efforts. We have tried to use various languages. We have tried to use various modes of communication with our media to ensure that we are clear in what we're saying. And that's the standard for all of us in leadership positions, is to be cognizant of that around you. Okay. I'm not going to look at it pessimistically because I do have the experience of being a public servant in this community now for some 40 years, and we have always had the opportunity to adjust.
But they had me to get this here, this powerful breed. This will help COVID.
Okay. So I'm going to remain optimistic. Whenever we have communicated with our community, what the bar is, they have always responded in a positive way, and that's what we are doing today. So I am optimistic that our community will respond. We still have a goal to reach, and what we're simply doing today is defining what the goal is for our community. All right, thank you all very much.